Now, I'm pleased to introduce our first speaker for the day, Anita Makori. Anita is actually a science graduate with a specialization in epidemiology and biostatistics. She's interested in the application of data science and statistical principles in the study, control, and prevention of infectious diseases. She currently works with CEMA-Africa as a data analyst and the Washington State University Global Health Kenya program as a research assistant. Anita is going to give us a quick dive into the nexus between data and health, giving us an insight into how they are connected. So please join me in welcoming Anita to the stage. Over to you, Anita.
Thank you. Thank you for the warm welcome. I'm very excited to be here and happy to join you from Nairobi, Kenya. And I hope everyone is doing great and you're all enjoying the conference. So today I will be talking about the nexus between data and health, and which is what I'm doing as my career. So I'll try to explain how data and health come together. So just to touch on what I will talk about, I'll talk about how I got where I am now. That is my STEM career journey. I'll also talk about what I do. I'll talk about the importance of data in health. And lastly, a message to anyone who would want to pursue a career that is similar to mine. So just to start on my STEM journey, I've always had an interest in health because I wanted a career that would help people not to get sick. The sight of sick people always makes me sad. So when I was thinking about a career, I always wanted to do something in the health sector. Also, my favorite subject in school was math. I hope there are other people who love math as much as me here. So I wanted a career that had health, but also an element of math. And that is where I landed on my sweet spot, which is epidemiology and biostatistics. So I graduated 2 years ago in 2020. And at this time, if you remember, we were at the peak of the COVID-19 pandemic globally. So the organization I work for, which is SEMA-Africa, was at the center stage of handling the pandemic here in Kenya. SEMA-Africa was responsible for advising the government on how to navigate the pandemic at the time. So therefore, I reached out to them for an internship, and I was offered a data scientist internship position at SEMA-Africa. So SEMA-Africa works concurrently with the Washington State University Global Health Kenya. So when I started my internship at SEMA as a data scientist, I was also a statistical epidemiologist intern at Washington State University Global Health Kenya. My internship lasted for 6 months, and after 6 months, I had done such a good job that I was taken up for my current role, which I will talk about next. So let's start with SEMA. SEMA in full is the Center for Epidemiological Modelling and Analysis Africa. And what we do at SEMA is we bring together professionals from different backgrounds, and we all have the common goal of improving health through data. So my role as a data analyst, what I normally do is one, I analyze data and present the results of this data in various forms. I use graphs, I use maps, I use charts in different forms, and that's one of the things I do. And another thing I do as a data analyst is I apply statistical models to assess the relationships between outcomes and risk factors. So just to touch on this, what we do is we have outcomes, that is health events, for example, someone being sick. And then we have the risk factors, that is what is causing them to be sick. So when we get data of people who are sick, we look into the data to try and identify what factors they share in common that made them become sick in the first place. And then another thing I do at SEMA is I facilitate training sessions on data analysis using a software called R. Then we move on to WSU GH Kenya. In full, this is the Washington State University Global Health Kenya program. And what we do at WSU is we conduct One Health research that aims to address health problems in Kenya and globally. So just to explain, One Health research means the intersection between animal health, human health, and environmental health factors. So what we do is we conduct research that touches on all three components so as to address a common health problem that affects human beings. And as a research assistant at WSU, what I normally do is I develop data collection tools. We normally work with projects, so I develop the data collection tools that will be used for this project. And another thing I do is I analyze and wrangle data. So what data wrangling means is just the data comes in blocks, like it comes in a huge chunk of data, and wrangling is just cleaning it. So basically, it's like identifying what specific data you want to work with and then analyzing it. So wrangling is like cleaning data. Then I also draft and edit research manuscripts, which we submit to research journals and are published. And that is what we read when we want to get more information about a subject. So that is what I do for my STEM career. And then I will also touch about the nexus between data and public health. So just to introduce this, data is analyzed. When we get data, we analyze it to establish the relationship between an outcome and a risk factor. So for example, if a group of people are sick, and we want to find out why this group of people is getting sick, we collect the common factors about them, for example, their age, their residence, their occupation, and then we look at the common factor among all of them, and then we try to associate it with the outcome, that is them being sick. And we do this using statistics because statistics helps us to know if a relationship between two things is significant. So that is how we conclude that doing one thing can lead to someone being sick of a certain disease. Data can also be fed into what we call models. And models, what they do is they help us to project possible scenarios. For example, if we have an outbreak of a disease right now, and we want to know where the disease will spread to, we use models to project possible places and possible people that might be affected by this disease. So that is how data helps us to understand pandemics and also to understand can control diseases. And from this, we can then make conclusions. Say we can conclude that a certain disease is caused by doing certain habits. And we can also conclude that the disease that is affecting people in one area may spread to another area. So you see, when we have this knowledge, we can inform policymakers and leaders, and they can then implement certain interventions to prevent the spread or prevent the occurrence of the disease. A good example is the current COVID-19 pandemic, and I'll use that to explain how data and health come together. So when the pandemic started, it was a new disease that had never happened before. So we had to understand what caused it. So we collected data on the initial cases of people who had COVID-19, and we tried to identify what they had in common. And by doing this, we were able to establish what we call risk factors associated with COVID-19. And that is in using that information, we are able to advise the public that by putting on your face mask and washing your hands, you prevent the risk of you contracting COVID-19. This came from us analyzing the data because we found out that the common factor was the people who had COVID-19 shared these factors. Another example is we used models to predict the waves of the COVID-19 pandemic. For example, we would use the initial data that we had when the pandemic started, and the models would help us to predict the number of cases that we'd have after a certain time period. And then in the model, we would introduce certain interventions, for example, vaccines. And this would show that if we have vaccines, the initial number of cases we had predicted would be less. So we are able to conclude that vaccination helps to reduce the severity of the pandemic. And that is why we introduce such interventions to the public, because the data has already shown us that this is how the disease would progress, and this is what the interventions would help with. Yes. And lastly, a word of advice to anyone who would want to join me in this career. First, STEM careers are a very fun challenge. What this means is that they're not easy, but they're very fun to do. Every single day, I learn something new, and that is always fun. Also, try to find something that is aligned with what you are passionate about. So, what I mean is, you ask yourself, what change would you like to make in the world? For example, for me, the sight of sick people makes me sad. So the change I would like to make in the world is reduce the number of people being sick. So that is why I tried to find a career that was in the health sector. But also remember I mentioned my favorite subject was math. So I brought something I enjoy, which is math, but it is in the sector that is aligned with my purpose. So that is why I chose a career that brings together health and math, which is data. So remember that you can achieve anything that you set your mind on and keep at it. I think all of you are doing amazing work and I've already started learning from you guys. So enjoy the rest of the conference and thank you for listening to me. Bye.
All right. Thank you so much, Anita, for that insightful presentation, especially seeing how you improve health with data science. I mean, analyzing data, deriving insights, building models, and also deriving decisions from data. Thank you once again for that wonderful presentation.